I'm Dr. Diana Kerwin. I'm an internist and geriatrician. I've been working in the field of Alzheimer's disease diagnosis and management for 20 years. That's a good question regarding, how do we define standard of care, and then how do we apply standard of care? And I think standard of care, we use the term a lot. It's sort of one of those that we don't always know what the definition is, and I think you do have to phrase it in not only who you're talking about as far as what disease state you're applying standard of care, but also who is the healthcare provider that you're applying standard of care to. So for standard of care, I think we really define it as using our current understanding, our current technology that's accessible and considered to be sort of widely available. Is that being used as a minimum to care for patients that are developing or that are experiencing Alzheimer's disease symptoms? And I do think standard of care now has shifted because of the biomarker breakthroughs. Standard of care used to apply to patients that were developing memory impairment. It was affecting their function. It was something that we wanted to address early so that patients could plan, they could prepare, they could know what was going to occur. Because at the time when we were talking about standard of care, it was really how do we identify it early, not because we had early interventions, but because we wanted to be able to have patients have the longest possible quality of life and reduce bad outcomes by addressing the problem early on, not necessarily saying it was because we were going to change the course of the disease, but we were going to improve quality of life and function during the course of the decline. Standard of care now has shifted because of our ability to identify patients earlier on using biomarkers. And now standard of care is going to change more as we do develop more disease-modifying therapies. Standard of care is going to switch from the physician recognizing early memory loss to physicians starting to understand how to apply biomarker-based diagnostics to the right patients at the right time. And then as therapies become available, begin to utilize those therapies in the right patients with the right biomarker profiles. So I think standard of care, again, I try to be very careful with being too judgmental of some of our fellow healthcare providers. I do think in primary care, standard of care is, can they stay as up to date on their understanding of the current diagnostic guidelines, the current classification systems? What should they be doing as far as identifying patients in their practice with either early memory complaints or at risk? Should they do biomarker profiling on those patients? But really just understand what is available. I think standard of care for specialists is a slightly different mode. This is where, our specialists in dementia have a slightly different standard of care of looking at, the broader spectrum of development of the disease modifying therapies, who is the right patient, the right timing for those therapies, and really moving that needle a bit further to being sure that patients are appropriate for the therapies, that they're getting appropriate safety monitoring and oversight and understanding of the disease modifying therapies. I think that standard of care will start to move as time goes on to be applied more to primary care as well as we get further into this. But right now, I do think there should be some differentiation between, what you're talking about as far as recognizable memory impairment versus biomarker-based early disease, and then also the standard of care regarding who the healthcare provider is and what their background is.